Good morning and welcome to our webinar, Sharing Your Wishes, How to Create an Advance Directive. We want to acknowledge that this might be a little bit more emotional topic than we usually tackle, but today's an important day. It's actually National Healthcare Decision Day. And, you know, we say this with a little bit of levity that death and taxes are the only two certain things in life. So let's get your taxes out of the way yesterday and let's talk about planning for your journey in the end today. So we are excited to bring you the knowledge and expertise of one of our amazing healthcares, and we'll meet her in just a few minutes. But first, let's talk about a few housekeeping items. So, I'm Kay, your moderator, and I'm happy to be here with you today and happy to help get questions over to our wonderful presenter. So if you are new or returning to our webinars, there's just a few important things that we want to remind everybody about. Today's recordings and resources will be available after the session at peacehealth.org/sharing-wishes. Yep, and I'll say that again, peacehealth.org/sharing-wishes. And we do really want today's webinar to be interactive, so there's a couple of polls and a quiz in there, and you'll interact with us in a couple different ways. The quizzes will come up online, and so you'll see those and vote using the radio buttons. And any of the other feedback, you can just go ahead and enter in to the comments section, and we will show you where that is. So if you're joining us via mobile, you can see over here, hopefully my little cursor shows up for you, you can see right here the red circle around the question mark at the top of your phone or your iPad device. And then if you're joining us on a desktop, you'll be typing your messages into this type of a box right here. This control panel should be showing for you. If you have any technical issues at any time, feel free to type those in there, and we've got a great group of team working behind the scenes here that can reach out and help you with that. So we'll also be answering questions at the end of the call, and we will take as many of those questions as we possibly can. Some we might not be able to get to just because of time, but we do know that your questions are important, and we want to get you all the information that you can on this incredibly important topic. So with that, let's make sure that we get you introduced to our fantastic speaker for today. Her name is Hilary Walker. She is our fellow caregiver from the Pacific Northwest Network. She's representing our facilities in Bellingham, Washington, Sedro-Woolley, Friday Harbor, and Ketchikan. But she's incredibly knowledgeable about the laws and policies on most of the states in the Pacific Northwest. So please help me welcome Hilary.
Good morning. I am so grateful to be here on this live webinar and talking with all of you on National Healthcare Decisions Day. And my hope is that through this next hour, we'll be able to normalize the conversation around advanced care planning and end-of-life wishes, and really take some of the fear out of these conversations and taking these conversations and translating them into a document.
Well, perfect. Let's find out what we're going to talk about today.
So we'll be discovering what advanced care planning is and why it's important, and how important it is to reflect on your values and personal beliefs, both in the conversation and finding a way to integrate that into the documents. Selecting your healthcare agent. So the healthcare agent is the person you would authorize to make medical decisions for you if you are ever in a situation where you're unable to make them for yourself. And that's really the most important decision we'll be talking about today. And then how to express that conversation and those wishes into a legal document, also known as an advance directive. And once you've completed the document, what next? What do we do with these documents to make sure that they're in a place where they can be shared and accessed when needed?
Perfect. Thanks, Hilary. Well, we are going to actually want to get to know our people who are listening a little bit more. So let's dive right in with the poll and make sure that we hit on all the topics that are important to everybody. And we are going to launch a little poll here. So let's go ahead and pick the radio button of what brought you here today. So has an advanced care plan been on your to-do list? You know someone who didn't have one and it wasn't good. My friend or family encouraged me to be here, and Mom and Dad, you better check that button. I'm curious, or I want to learn more, or just other, and you can type your response in the chat window. So it looks like we have a few responses coming in. We'll give you just a few more minutes to vote here. It looks like our number 1 is leading the way. It's been on my to-do list, but curious and trying to learn more is coming up as a close second here.
Mm-hmm.
We'll give you 5 more seconds here just to get voting, and we'll close the poll. All right. We're closing the poll. So it looks like, share. I'm going to share those results with you now. So it does look like it's been on my list, and I'm thinking about getting it done here. Finally taking some of those steps is the main reason why you're all here today. So we're glad it's been on your list. That's a really great thing to have there. And let's help you today get that a little bit farther to being checked off the to-do list. All right. Here we go.
So for those of you who said it's been on your list, but you're just getting around to it, you're not alone, and we'll be talking about that in just a moment. So what is advanced care planning? So advanced care planning is really sharing your personal goals, values, religious and cultural beliefs, and what matters for the quality of life, as well as completing an advance directive. So a big piece is having the conversation and then translating that conversation into a document. So as we talked about briefly, an advance directive is a legal form that you'll fill out that will describe not only the kinds of medical care you would want if something happens and you're unable to speak for yourself, but also who would you authorize to make those medical decisions for you on your behalf. And really just emphasizing that putting your wishes in writing really helps avoid confusion or conflict in times of crisis or uncertainty. So I'm coming to this work of advanced care planning after working as a therapist in acute care and ICU settings for 15 years. And I saw firsthand how important it is to have these conversations and complete these documents before a time of crisis or before an acute situation happens. So again, I'm grateful that you're all joining us today for this conversation. So many people said I've been putting it off. So why advanced care planning? People are more likely to receive care that matches their goals and honors their wishes. However, 82% of people say it's a good idea. About 23% have actually done it. So again, as I said, those of you who out there who are thinking that it's a good idea but haven't actually gotten around to completing the document, you're not alone. We're looking at increasing those numbers quite a bit. Another reason why advanced care planning is important is people are more likely to be where they want to be at the end of life. So this is a really key percentage that we bring up a lot in our classes, is that 70% of people prefer to spend the last days of their life at home. However, currently about 70% of people are dying in long-term care facilities and hospitals. And one of the big reasons why that is lack of conversations and advanced care planning prior to a significant event happening. Another reason why advanced care planning is so important is people spend less time in the hospital at the end of life with less aggressive and non-beneficial treatment. So on average, 10 fewer days are spent in the hospital during the last 2 years if somebody has participated in advanced care planning. And lastly, I'd just love to bring your attention to this lovely photo on the right-hand side. Tell them you love them. This is a dear friend from the Anacortes Center for Happiness in Anacortes, Washington. And really, those of us who are in advanced care planning feel really strongly that this is one of the greatest gifts that you can give to your family, is engaging in these conversations and how to care for you if you're unable to speak for yourself. So that in those moments, when and if that happens, that your family believes that they're doing the right thing. So these documents, in a way, I've heard them call a love letter to the ones you love. And I like the way that we look at that as far as what advanced care planning can do for us and those we care about.
Yeah, so Mom and Dad, I expect this to be gift wrapped under the Christmas tree this year.
So if it's such a good idea, why aren't people doing it? So we're just going to talk briefly, elevate some of the barriers, and some of you on the call may relate to some of these barriers. A big one is that talking about end of life is not easy. It's not easy for anybody. It really needs skilled and facilitated conversations. And really the topic is uncomfortable for everyone. So Atul Gawande, who wrote Being Mortal, really talks a lot about advanced care planning and how quite often we as consumers of healthcare, community members, really need to initiate these conversations with our providers and those who are caring for us, that the conversation a lot of time will come from us. So it's not easy for anyone to talk about, even those of us who are in the healthcare field. So it's good to just keep that in mind. The process of advanced care planning and completing an advance directive can be confusing. PeaceHealth branches out across Alaska, Washington, and Oregon. Alaska has one main document they use in the state. Oregon also has one state document that they use. So if you're in those states, it's a little easier to figure out which document to complete. In Washington state, there are over 8 documents being used. Some say up to a dozen documents being used throughout Washington state. So it can be confusing. Which document do I use? What's the difference between the documents? And we'll touch on that briefly. And we'll also guide you to the PeaceHealth Advanced Care Planning website that has links to the most commonly used documents in Washington state. There's also links to the document in Alaska and Oregon as well. Another reason why people hesitate doing advanced care planning documents or advanced directives is that they believe they need a lawyer to do these documents. And where lawyers can assist with living wills or health directive documents, it's not necessary to have a lawyer to complete these documents. There are some witness and notary requirements. We'll be talking about that briefly at the end. But absolutely anybody can spend time with these documents and complete these documents for themselves and their families. So I'm curious, what else are some barriers? If you want to type anything in the chat window, what are some barriers that have been coming up for you all who are on the call? Those of you who think it's a good idea but have been putting it off, what are some of those barriers that we haven't talked about?
Oh, they talked about, in some circumstances, this is one of our listeners that says cultural and religious beliefs. They know it's an abomination or frowned upon to discuss the end-of-life process. So
yeah.
It sounds like that cultural and religious barrier may be one. Again, here's that confusion about which document. Laura says, in Alaska, I can think of several, five different things, 5 wishes. They're taking time, having instructions and materials, so just the time that it needs to fill out everything sounds like it's a little bit of a barrier. There's one, somebody says, I'm young and I don't want to think about it. But yeah, we're not all invincible, I get it. Yeah. There's another person that writes, if I write it now, does it mean that if I'm older, do I have to follow what I write now? Somebody says lack of knowledge. And I do apologize. It does sound like we have a little bit of an echo going on, so I'm not sure if anybody's got sound on in your room. Hilary, if you want to shut it down, that'd be great. I'm sorry about the echo, guys. And talking with their sons who are not thinking about end-of-life stuff is another person's comment. So sounds like, yeah, a lot of these have familiar themes to them. Family, you know, we'll dive into, you know, who might be your healthcare agent. It doesn't necessarily have to be young folks who aren't necessarily thinking of end-of-life stuff too. So these are all great things to share, and I think none of them are insurmountable.
Yes, thank you for all of those statements and comments that people made. I'm hoping that we'll touch base on a lot of them through this webinar, and then some of them, please bring up questions again at the end if we haven't touched on some of them. But let's talk briefly about the 3 decisions or conversations that affect your plan. So the first one is your healthcare agent, who you want to be your healthcare decision maker. So this is really the most important decision that you'll make in completing the document. The document where you name a healthcare decision maker is a durable power of attorney for healthcare. We'll be talking about that again down the road in the webinar. But I just want to say briefly that one of the comments that was made was, well, two of the pieces that were brought up is, if I write something now, can I change my mind later? So these documents, I like to call them living documents. You can change the documents at any time. The documents that you're completing are really for who you are right now, as if they were going to come into play in the next 1 to 10 years. So as far as choosing your healthcare agent, your healthcare decision maker, who is it in your life right now who you would trust to make those decisions on your behalf, and you can change it at any time. Another decision that is helpful to talk about and put some information down in a document is cultural, spiritual, or personal beliefs that you have that might impact your decisions and that would be important for others to know. So this is really key. We live in a very diverse culture right now, and there's a lot of different people with a lot of belief systems, a lot of different ideas around end-of-life care, caring for people when they're in that stage, what happens after somebody dies, how do we care for people in that time. So being able to communicate that with people who are around us and figuring out a way to communicate that into a document, in case people who have never met you before are caring for you, it's really helpful for them to understand your cultural, spiritual, or personal beliefs that might impact the kind of care you would want. And then the last decision or conversation is in the health directive itself, is to treat or not to treat. What healthcare would you want to receive in certain medical situations? And again, we'll be touching base on all three of these. And it's important to keep in mind that these documents are separated out into different parts. So if you're most comfortable with just choosing a healthcare agent who you would authorize to make medical decisions for you, but you don't feel comfortable putting your spiritual or personal beliefs in writing, or you don't feel comfortable at this time of your life choosing what medical care you would or would not want, you can choose to do just the part of the document where you name someone to make medical decisions for you. So there's a lot of baby steps you can take that will get you moving in the right direction to make sure that your voice will be heard if you're unable to communicate at some point in your life. Does that make sense?
Yeah, it sure does. That, you know, kind of do the pieces that you can and that you're comfortable with, and then as you become more comfortable, you could do a little bit more.
Yes. Yeah.
Oh, this is my favorite.
Yeah, I love this photo. So choosing a healthcare agent is really, I couldn't emphasize it enough that it's the most important decision that you'll have to make in advanced care planning. Do you want to say something, Kay, about why you chose this photo? I like your story.
Absolutely. I think, you know, we've kind of gone through choosing this healthcare agent, and I think, you know, working through all the different pieces and backgrounds of it, I cousin it to choosing glasses. After you've had your eyes dilated, you can't really see. And I know I go with my husband when he gets his, and he trusts me incredibly to make sure that we pick out glasses that look good on his face and that fit him. This is really kind of similar, you know, on a you know, glasses are a smaller scale, obviously, than choosing your wishes for end of life care. But you know, it's that same kind of trust that you're putting into someone when you're choosing them as a healthcare agent, as you are choosing them with, you know, your face first, that, you know, is what greets the world. And so something that you put on your face is just probably as important as the wishes that you would want followed.
Yeah, that's great. I love it. So how do you choose? So let's just talk about that briefly. You want to make sure that you choose somebody that you trust, first of all. A question that comes up a lot is, does the person I choose need to be related to you by blood or marriage? The answer is no. It can be a close friend. It does not have to be someone related to you. So that's a good thing to know. It absolutely needs to be someone that you trust. Another question comes up is, does this person need to live locally? And the way that our families are spread out all over the country these days, and even in other countries, that's an important thing to address. And the person who you trust the most to be your primary #1 decision maker does not have to live locally. Most documents do allow you to name more than one person. So if your first person does not live locally, it may be helpful to choose your backup person, somebody who does live locally, who can be there in physical presence until your #1 person shows up. But most important, someone that you trust. Someone that you believe will follow your medical decisions even if they don't agree with them. So it's important when we're talking with somebody, going over our documents with the person who we may choose to be our medical decision maker, to make sure that they're willing to follow our wishes even if they don't agree with them. So we don't always have to agree with the decisions that our loved ones might make, but we have to understand them enough to be willing to honor them. And lastly, sorry, go ahead. Yeah.
No, I got it. It's exactly like that glasses example. I know my husband wanted a really high-end, expensive pair, and I didn't agree with him. But in the end, it was what looked good on his face and what he wanted. So yeah, absolutely.
Yes. Yeah. And you really want to choose somebody who can handle stressful and uncertain situations. So if you think about it, whoever you choose as your healthcare agent or healthcare representative, healthcare decision maker, will likely be in a medical situation, potentially in a hospital situation, and needing to talk with lots of doctors and caregivers and really strongly advocating for you on your behalf. So occasionally people will say, well, I have 5 children, who do I know how to choose? And I would say 2 helpful hints. One would be, talk with them about your wishes and ask them, which one of you do you feel like could honor my wishes and really show up for me in this way? And then you would know really well of the options that you have for healthcare agents. Who do you believe could handle stressful and uncertain situations? One of my mentors in this work one time said at a very large conference, you have to choose a bulldog. And I thought that was just sort of a great thing to think about, is that you want to choose somebody really solid, who's really willing to go to bat for you, for lack of a better way to say it. So these are just some helpful guidelines when you're thinking about, I wonder who I would choose as a healthcare agent. Just some things to consider.
Yeah, those are definitely great stuff to think about.
Mm-hmm. So let's talk briefly about who decides for you if you don't choose a healthcare agent. So we saw earlier in the webinar, 80% of people think this is a good idea. Only about 23% of people have actually completed these documents. So what happens if you don't choose a healthcare agent? Then the doctors, your caregivers, we want to talk to somebody. So the legal order of decision maker is as follows. At the very top of the list, not included in this slide, is a legal guardian. That's just a rare situation that somebody would have a legally appointed guardian. If you do, they're the #1 decision maker. Next in the list is who you chose as your healthcare agent. So if you have not taken the time to complete a durable power of attorney for healthcare or chosen a healthcare agent, the first person we need to speak with is your spouse or registered domestic partner. So some things to keep in mind around that is that in some situations, maybe your spouse is who you would have chosen anyway. But as we're dealing with the aging population in our culture, and occasionally the beauty and the challenge is we age together. So sometimes one of the spouses will have early stages of dementia and may not be the best decision maker for their spouse. Occasionally, both spouses have pretty significant chronic conditions, readmissions to the hospital. So the stress of being the decision maker for their spouse may put the other spouse into their own healthcare crisis. So it's just a good thing to think about. And as we say, spouse and registered domestic partner, I just want to bring to the attention that if we have a partner that we are not a registered domestic partner with, or we're not legally married with, they have no legal rights to make medical decisions on our behalf. So there are a lot of couples that live together who are not married. And some of those people have children together. Very important that if they want that person to be their medical decision maker, that they complete a document and name them in that document. So if you haven't chosen a healthcare agent, it would first be your spouse or domestic, registered domestic partner. If you don't have a spouse, the decision making would go to your adult children. So I always like to emphasize that adult children are 18 years of age and older. 18 is pretty young to have to make medical decisions for their parents. And one thing to keep in mind is in Washington state and many other states, if you have more than one adult child, they have to all agree on the type of care you would or would not get. So this can get really tricky. If you think about having all your adult children in one room trying to decide what you want for dinner, imagine how challenging it might be to have all your adult children in one room trying to decide on really critical medical decisions for your parents. If you don't have a spouse and you have no adult children, the next people we would need to call upon to make medical decisions for you are your parents, your living parents. So that's at any age. And another thing to keep in mind is if you're in the younger generation, that if you have no spouse, no adult children, and you haven't named a healthcare agent, in many states, both of your parents would need to be called into the conversation. And in Washington state especially, they would need to agree on the kind of care you would or would not get. And that's true even if your parents are divorced. So that's a good thing to keep in mind. Another really key thing to keep in mind is that step parents are not included in this legal order of decision maker. So I'm a stepmother. When I found that out, I was a little bit surprised. So if you are of the younger generation or even older generation and the parent you trust the most is one of your step parents, you absolutely need to name them as your medical decision maker in the document. If you have no spouse, no adult children, no parents, and you haven't named a healthcare agent, the next people we need to talk to are your adult siblings. And again, if you have more than one sibling, we need to give it our best effort to reach all of your siblings. And in many states, including Washington, all your siblings would need to agree on what kind of care you would or would not get. So I'd like to spend a little bit of time on this, so thank you for paying attention to that. This is usually the key piece that gets people motivated to complete these documents, so that you, in your current state of health and current state of mind, understand that you have the option to choose who would be called in to make medical decisions on your behalf.
That's a lot of people.
Yes.
Yeah, I'm having the realization my husband is one of 16 children, so his mother lives out of the country, so to have all of his siblings being together in one room and trying to make decisions would be a little scary.
Yes, very, very good thing to think about, absolutely. Yeah. So we've talked a lot about that first decision, who would be your healthcare agent. So we're going to talk briefly about the second piece of the conversation is, what do you value? How can we engage in deeper conversations about what makes your life worth living? What level of engagement with others is important to you, not only physically but mentally? And one of my great mentors says a lot, what is your line in the sand, when she's talking to her patients who she's assisting with advanced care planning? What is so important to you to be able to do in your life that if you are unable to do that, you may look differently at the quality of your living? And that's different for everybody. Atul Gawande brings up a great example in his book, Being Mortal, that he had a patient who said, as long as I can eat chocolate ice cream and watch football, I'm good. So if he was needing care with anything else in his life, that was still a quality of life for him. For some people, that wouldn't be enough. So I love to share this example of a personal value statement that a dear woman named Theo Wells wrote in her advanced care planning document. She was the author of Take Care of Dying, Get On with Living, which is a book she wrote when she was 90 years old. And her personal statement was, it is here. To me, to be alive is to be able to read, write, speak out, learn, share, and care among others in my community. If I cannot do so, it's time to move on to a more fruitful continuance of soul growth. To me, that transition is death. So those 3 sentences for her, for that person, really summed up who she was, what was important to her, and what was her line in the sand. At what point would she be willing to potentially start leaning more towards comfort-focused treatment rather than maybe full treatment in a hospital setting? So engaging in this conversation is also where we start talking about religious, personal, and spiritual beliefs that are really important to us. And it's helpful to put it in writing because we might think that our family knows us really well and would just know what we would want. But quite often we see in stressful situations, we forget. We forget what's really important sometimes to even the people that we love the most. So if we can write it down, it's really helpful. I know there are a lot of cultures that don't want to write down anything specific about end-of-life care, so just engaging in the conversation around what's really important to you. And I always love to bring the attention to that when we go in the hospital a lot, we give information about who we are, and sometimes we give people what our religion is. And some people might say, I'm Catholic. And to them, it may be because they were raised Catholic. They may not be practicing Catholic. Same if somebody says, I'm Jewish. Maybe they were raised that way, but they're no longer practicing in that way. So if we're at a situation where we, as your caregivers or providers in a medical facility, need to know how to care for you, if we just see that on your line where it says religion, we can't even begin to understand what that means to you, what's important to you. Does that mean that you want a priest in your room doing last rites? Does that mean that you only want a certain type of caregiver taking care of you? Does it mean your bed needs to be facing a certain way when you're going through your dying process? All of these things are things that I've heard from people who have shared religious and cultural beliefs with me in our conversations. And I can say from my time in the hospital, we can't necessarily know that about you just because of knowing what kind of religion you identify with or what you have as part of your medical record. So this is a really key conversation to include as we're going through these documents and engaging with those we love.
You know, and I think that is really wonderful to hear that caregivers do their very best to try to honor those pieces that, you know, maybe moving a bed would be, you know, obviously there's going to be a lot of wires and things to move, but to know that they would go to that length for you, that's a wonderful, wonderful comfort.
Mm-hmm. Yeah, I think it's always good to remember that we're human beings taking care of human beings. So as much as we can know about you, we will do our best to care for you the best we can. And if we don't know, then we're guessing. So that's a huge reason why these documents are important and these conversations are important. So the last thing that we talk about, which is oftentimes the hardest piece for people to wrap their minds around, is to treat or not to treat in certain medical situations. So I'm just going to read briefly what is life-sustaining treatment. So that's what comes up a lot of these documents. If you were in a certain scenario, would you or would you not want life-sustaining treatment? So this wording I'm about to read is from the Honoring Choices Pacific Northwest Advance Directive. Life-sustaining treatment, otherwise known as life support, can keep you alive by maintaining or replacing important bodily functions like breathing using a machine. Some examples of life-sustaining treatment are CPR or cardiopulmonary resuscitation, breathing machines, feeding tubes, kidney dialysis, antibiotics, etc. Life-sustaining treatment may be used temporarily until a patient's body can function on its own. In other situations, life-sustaining treatments can prolong the dying process without the possibility of being cured. And this is a really important sentence I want you to hear, and it goes along with the second bullet point there, that comfort care will always be provided. Easing pain and providing comfort are part of routine care and are not considered life-sustaining treatments. So if somebody chooses in certain scenarios to not continue life-sustaining treatment, it's very important to understand that your pain will always be addressed, your anxiety will always be addressed, your breathlessness will always be addressed, etc. So one challenge in most health directive documents is that as far as to treat or not to treat, most documents cover only a terminal diagnosis in which life-sustaining treatment is only prolonging the dying process, and death would likely occur within a short period of time without that life-sustaining treatment, or the documents cover a persistent vegetative state or a coma. So it's through the legislature, it's law why these are the only two scenarios that are covered in a health directive. One challenge with that is that Dr. Gaster from UW recently spoke, and he said 1 in a 10,000 chance that you are going to be in one of these two scenarios at a time that somebody needs to make medical decisions on your behalf. So all to say, if we don't include that middle key piece on who we are, what we value, what's important to us, and we just choose a healthcare agent and then say, if we're in a terminal diagnosis or in a coma, continue or discontinue treatment, we are leaving a lot of gray area for that healthcare agent to still make decisions on our behalf around. So it's really important for us to talk about what do we value, what does quality of life mean to us, so that if we're in a different scenario that's not necessarily covered in a health directive, that they have, our healthcare decision makers have more information to go on. Does that make sense?
It sounds like it, yeah. We had one question that says, in their experience, healthcare providers must be told emphatically what comfort care means to the patient. There are some techniques for relying on that message. So she's asking, how do we relay ooh, we've got a little feedback going again. Sorry, gang. It asks, how do we go ahead and share with the caregiver what those comfort care techniques are?
Well, you bring up a good point, because comfort care is different for everybody. So across the board, your pain, anxiety, and breathlessness will always be treated. And I think we're creating a really beautiful cultural shift in our medical facilities, where we're really attending to people and their pain and anxiety and breathlessness more. If somebody's on hospice, the folks in hospice are really good with making sure that those comfort care procedures are followed. I don't totally understand the question, but I think that if you have specific comfort care, what that means to you, what comfort care means to you, you should absolutely include that in your document. So most documents have additional directions, anything else you want to share. So if comfort care to you means having somebody always holding your hand, having acupuncture, having massage, having a certain kind of music, those things are really different for everybody. There are some people, for them, comfort care is they want to be alone when they die. And for some people, comfort care is they want their room full of everybody that they love, as many people as possible. So I don't know if that answers the question or not, but really the key pieces of comfort care in a medical facility is making sure that pain, anxiety, and breathlessness are always attended to. And as far as comfort care beyond that, it really is individual. And it's important for your healthcare agent to understand what comfort care means to you.
We got a thank you back. Yeah, it sounds like that was what they were looking for.
Good.
Okay.
So we've been touching on a lot of things here. So I just want to say, in summary, We've been talking about advance directives. Advance directives are for all adults 18 years of age and older. So as soon as somebody turns 18, they have a legal right to make a decision about who would make medical decisions on their behalf. So it's really important to think about. I was just at my best friend's home, and she was celebrating her son's 18th birthday. And I gave it a little bit of time, but then I said, you're aware she's not married, you're aware he's now your medical decision maker, and her eyes nearly popped out of her head because 18 is still pretty young. So she immediately the next day completed an advance directive and named somebody other than her son, and spoke with him about it. And so it's just important to keep that in mind. All adults 18 years of age and older should have an advance directive. That advance directive can change at any time, so just keep that in mind. And we'll talk briefly at the end of when to review these documents. So an advance directive includes who will be your healthcare agent. The document where you name those people is the durable power of attorney for healthcare. Sometimes people call the person the durable power of attorney for healthcare. If there's a lawyer on the call or in the room where you're speaking, they'll quickly let you know the durable power of attorney for healthcare is the document. The healthcare agent or healthcare representative is the person. The advance directive also includes a health directive, which has specific instructions about the care you would or would not want in those two scenarios that we talked about earlier. Most documents have those additional direction lines that I'm referring to, so you can just, these documents are your personal documents, so you can cross out whatever sentences don't make sense to you. You can write in additional directions, what comfort care means to you. If you were dying, where would you want to be? What else would be important for people to understand about you, those religious, personal, spiritual beliefs. You can write on those lines. I will say make sure that you write it in handwriting that's easy to read. Sometimes people get very excited and write really quickly in script that's difficult to read, and we want to make sure that it's that we can understand what you're wanting us to know about you in these documents. So advance directives are for everyone 18 years of age and older. So we're going to touch briefly on the difference between a POLST and an advance directive. This is a pretty hot topic up across the nation right now because these are two very different documents that can support each other. But a POLST, which is a physician order for life-sustaining treatment, that's what POLST stands for, or excuse me, a provider order for life-sustaining treatment. It can be signed by an MD or a nurse practitioner, a physician assistant. In Oregon, it can be signed by a naturopath. So a provider order for life-sustaining treatment. The big difference to know about these documents is an advance directive, as we mentioned, is for anyone 18 years of age and older. A POLST form is based on your current medical condition and is really meant for people who are towards end of life or have a frail medical condition where aggressive care such as CPR or full treatment in an intensive care unit could potentially do more harm than good. So the POLST form, again, is based on your current medical condition. It's a communication tool to communicate to emergency responders. It's the only thing that emergency responders can follow in what we call the field. So a lot of times people will say, I have a POLST and it's on my refrigerator. That's where the emergency responders are looking for these documents to answer two very important questions. Does this person, this patient, want CPR if they had cardiac arrest? Do they want cardiopulmonary resuscitation? And do they want to be transported to a hospital to receive treatment? So again, this is the only document emergency responders can follow in the field. If you have an advance directive, even if you put it under your refrigerator, it's not a doctor's order, so they can't follow that. This is signed by the patient or the surrogate decision maker and the provider. An important thing to keep in mind is that these documents, the physician order for life-sustaining treatment, do not establish a legal decision maker. a legal healthcare decision maker. On the back of these documents, it has emergency contact. That is not the same as establishing a legal decision maker in a durable power of attorney for healthcare. So if somebody only has a POLST, one of these documents, we strongly recommend you also complete a durable power of attorney for healthcare to name who is legally authorized to make medical decisions for you. A big difference between an advance directive and a POLST as well is that an advance directive needs to be completed by the person who the document is about. So once somebody loses their decision-making capacity or their ability to complete a directive, then no one can complete an advance directive on your behalf. However, this physician order for life-sustaining treatment, your surrogate decision maker or healthcare agent can complete one of these documents for you in collaboration with your provider based on what they believe your healthcare goals are given your current situation. So Advance Directive is for future scenarios, information about an unexpected event that may happen in the future. A POLST form is based on your current medical situation and is only for a certain population of people. Is that helpful?
Yeah, I think a POLST kind of is the beginning of the journey to things. You know, you obviously have to be transported if you want to get to the hospital and those types of pieces. So there's definitely a difference in these two documents.
And there will be many classes coming out on the longer informational pieces about the differences between these two documents and who needs which document. The best thing to do is to talk with your provider. Absolutely everyone 18 years of age and older should have an advance directive. If you believe that you or your loved one would benefit from having a physician order for life-sustaining treatment, then talk to either your or their primary care provider.
I also had one question from Diane. She asked, does the document need to be handwritten?
The advance directive document?
Yep.
Most of the documents now are not digital, so they're actual paper copies. So most of them are handwritten. If you have a way to convert a PDF into a program in order to type in your answers, you can do that. I know somebody who did that recently. So I guess the answer is they don't have to be handwritten, but most documents are still paper documents. So if you have a special way to put it into a typewriter or convert a PDF on your computer, you can type in your answers to the directive and then print it out.
Perfect.
Yeah.
All right. Well, sounds like we're ready to go. What do we do next?
So if you're ready to get started, here's what to do. And everything that we're going to talk about here is in a document that you will have access to at the end of this webinar called Advanced Care Planning Next Steps. So the next steps are decide who will be your healthcare agent and have a conversation with them about your wishes. So before you write someone's name on the document, make sure you talk with them, and it's a shared decision-making agreement that they are willing to be your healthcare agent. So decide who will be your healthcare agent, who you hope would be willing to speak on your behalf, and have a conversation with them about your wishes. Complete an advance directive for the state in which you live. And again, you can go to the PeaceHealth website that will be provided at the end of this webinar, and we have links to the most commonly used documents in Alaska, Washington, and Oregon. If you are using a document that's not listed there and it's a state document, you can use whatever document you want to use. A lot of people have documents written up by lawyers. I would recommend that you look at those documents and make sure they make sense to you, and that it has as much information on there as you want before passing it along. So complete an advance directive, which includes a durable power of attorney for healthcare and a health directive. Have the documents witnessed and or notarized based on your state laws. So I can let you know that in Washington State, the durable power of attorney for healthcare document is witness or notary, and the healthcare directive requires 2 witnesses. There's very specific directions on those documents as far as who can and cannot witness those documents for you. So you want to look at the state in which you live and find out what the witness and or notary requirements are to make it a legal document.
And I think notaries are fairly available these days. I think I ran into one at our bank the other day.
Yes, a lot of banks and financial institutions have notary. There's even notaries at UPS stores now. There are notaries are not difficult to find. The witnesses are sometimes a little bit trickier because the witnesses cannot be related to you by blood or marriage on most documents. But the witnesses are just witnessing your signature and that you are who you say you are. So sometimes if you've been banking at the same place for a while, not only will they notarize the document, they will witness one of the documents for you as well. But that's something to call your financial institute and find out what they're willing to do for you.
Nice.
So after you've completed the document, you want to make copies of the Advance Directive. Always keep the original. And this is a really big thing that we would like to elevate to everyone, is what to do with the documents once you've completed them. So a lot of people say, well, I have one, but it's in a drawer somewhere and I'm not sure where it is, or it's in my safety deposit box, or my lawyer has it. So we want to make sure that you give copies to your healthcare agents. Who you've chosen as your healthcare agent, have them review the document, make sure they understand it. If they have any questions about what you're asking them, how you're asking for them to advocate for you on your behalf, talk about it now over tea rather than them trying to interpret your documents down the road. So make sure your healthcare agents have a copy. Make sure your primary care provider has a copy. In many situations, your primary care provider can be reimbursed for having conversations around advanced care planning. So you can even review your end-of-life wishes, what you've chosen on your advanced care planning document with your primary care provider. And then you want to make sure that there is a copy on file at your local hospital. So if your local hospital is a PeaceHealth hospital, the address and or fax number is here where you can mail it in. Make sure that your document has your date of birth on it to make sure it ends up in the right medical chart. Even if you have never been a patient in PeaceHealth before, but PeaceHealth is your local hospital, we will create a medical record file for you just to hold your Advance Directive on file. I know a lot of local hospitals are following suit on that, so if your local hospital is not a PeaceHealth hospital, I would call the hospital closest to you and call their medical records and find out if they would be willing to create a medical record for you and have a place to hold your Advance Directive on file. So it's easily accessible if you have an emergency situation.
And I think there was somebody who asked a question a little bit earlier about traveling, and they were out of state. And so that's a really great piece to note, is that if you're out of state and they look at your driver's license and they find the hospital closest to where you live, they can then pull your medical record for you.
Exactly. And if needed, your Advance Directive could get faxed to the hospital where you're receiving care. And in a lot of situations, people carry their Advance Directive with them, or if they have that physician order for life-sustaining treatment, carry a copy of that with them as part of their travel documents. So it's not a bad idea. You know, we're going over all the ways to cover all your bases to make sure that in an emergency situation that your document will be found and that your document will be followed. So by all means, you can carry a copy with you as part of your travel documents. It's not a bad idea.
Yeah, just kind of fold up something small and stick it behind your passport maybe, or your driver's license in your wallet.
Yes, and at the end of the webinar, we have a document that's a wallet card from the Honoring Choices Pacific Northwest. You can print that out, create a wallet card. Some people are making them on colored paper and laminating them nice and fancy and stick that in your wallet. The wallet card says, this is who I am, this is my birth date, this is who I've chosen as my healthcare agent, this is their phone number, and my advance directive is on file at either PeaceHealth Hospital or whatever your local hospital is, so that you can carry with you in your wallet as well for some more information.
Well, sounds like that's a great plan and good travel document.
So just real briefly, when to revise the documents, you want to look at them, the 5 Ds you'll hear in the advanced care planning world. Every decade, you want to relook at your documents. If you go through a divorce and you've named your spouse as your primary agent, you may want to relook at your documents and see if you want to change that. If you have a new diagnosis or a decline in your health, you want to relook at the documents and make sure that they still reflect your current wishes, and maybe they need to be more specific given your current state of health. And then the last D is death, and that is either death of who you named as your healthcare agent. You want to relook at your documents and make sure the names that are still existing on there that you're happy with, who would be making medical decisions for you, or make a change if you need to. The other time that death comes into play as well, we're finding, is that if someone close to you dies, quite often it can change how we look at our own end-of-life experience. So we might want to relook at our documents and say, oh, well, I want to make sure I'm really clear that I don't want that, or now I think I do want that, or whatever it might be. We've recently come up with 5 Ds and an M. So the other time that you'd want to relook at your documents is if you move. It's best practice to complete a document in the state in which you live.
So the M, the move, I think somebody did ask about moving. Do I have to fill out all new forms for that state if I move?
That is best practice, because all states have different legal requirements for the documents. And really, most importantly, if you complete the document for that state, then the people who are looking at those documents to help guide your care in the hospital will be looking at documents that are more familiar to them. So best practice is to complete a document in the state where you live.
So we'll just jump online in that new state to their .gov and look for Advance Care Directive.
Yes. Yep.
Perfect. Well, I know we've been asking a lot of questions along the way, and hopefully we've gotten answers to most of them, but we do have a little bit of time for a couple more. If there's something that somebody asked that we didn't quite get to, feel free to zip that into the chat box there, and we'll try to get you an answer from Hilary here.
And while we're waiting for questions, I just want to emphasize that more and more there are classes and communities where you live around advanced care planning, informational sessions like this, as well as workshops that walk you step by step through completing a document. So I would encourage you to go to the PeaceHealth website if you are a PeaceHealth patient and find out, or live in a community where there's a PeaceHealth hospital, and find out if there might be some classes coming up in your area. If you don't have a PeaceHealth in your area, sometimes the local senior centers have lots of great information, or the local agency on aging would have great information about advanced care planning workshops in your area.
Yeah, and we did share in the question and answer section, if you or someone you're interested in an in-person class on advanced care planning, there are some that are offered through the PeaceHealth community, so you can jump onto that peacehealth.org/advance-care-planning-classes. All right. Well, I think we've covered all the questions for today that we can get to. So we're moving along here, and we appreciate your time and want to thank you for being here. We do want to remind you, so there's 2 different websites that we've been talking about here, Advanced Care Planning and then the Sharing Wishes. So for all of the documents related to this webinar, including printouts of the slides, you can go to peacehealth.org/sharing-wishes. You'll also see an overview and a resource list available, an advanced care plan that you can print out and work on what's next, and then that beautiful wallet card that we talked about. So Hilary, I can't thank you enough for your time today on this important topic. We hope that National Decision Day is one that sparks some conversation around some coffee tables and gets some documents written so that our wonderful healthcare caregivers can really help make the end of life beautiful for people and honor their wishes. So we do ask you, though, that are listening, if you wouldn't take just a brief moment. I know our audio's been a little bit iffy today, but if you wouldn't mind taking a little survey and letting us know how we did, and if this was a topic that you'd like to hear more about, or if there's another topic that we can help bring you from PeaceHealth and our experts that we have to share with you, we would love to know that. So thank you again, and again, PeaceHealth is always here to help. Thank you again, Hilary.
Thank you so much. Have a beautiful day.